I guess I'll never know what I missed on that first day of health class.
Don't have sex, because you will get pregnant and die. Don't have sex in the missionary position. Don't have sex standing up. Just don't do it. Promise? Okay, everybody take some rubbers.
Why don't they just...
Chlamydia is also known as a silent infection. It's caused by bacteria. While most women and men are symptom-free, some symptoms are painful urination, discharge, and itching at the tip of the penis. Some consequences are sterility or infertileness. You can pass it on to others, and pelvic inflammatory disease. The treatments are antibiotics, and chlamydia can be tested by urine, pap smear, or a sample of discharge.
Gonorrhea is also known as the clap. The cause is bacteria. Some of the symptoms are pain during urination, discharge, which can be green, yellow, or white, or there can even be no symptoms. Some consequences are that it can spread to others. It's sterile for both male and female. It may cause heart problems or arthritis. The treatment is antibiotics, and testing can be done through urine, pap smear, sample.
Genital warts are also known as HPV. The cause is a virus. Some symptoms are that it is a painless wart, which resembles a cauliflower. Some consequences are that it might grow or get larger, and some treatments are laser, freezing, or surgery. And testing is visual. There's no blood or urine test, and a pap smear, which is a sample of cervical cells.
Herpes is caused by a virus. Some of the symptoms are painful fluid-filled blisters, and also flu symptoms caused by a weak immune system. Some consequences are reoccurring outbreaks, and you can pass it on to your partner. Treatment is antiviral drugs that reduce the number of outbreaks or heal blisters, and then there's also topical creams. And testing is done through blood or a visual diagnosis.
Syphilis is caused by bacteria. Some symptoms are a painless sore called a chancre, and rashes on hands or feet. Some consequences are that it can be spread, and also permanent damage to vital organs, and in some cases even death. Some treatments are antibiotics, and testing is done through the blood.
Did you know 1 in 2 sexually active young people will get an STD by the age of 25, and most won't even know it? Also, did you know every year there are about more than 19 million new STD cases in the U.S. Nearly half of these cases are among young people aged 15 to 24. Also, about 1 in 6 people are infected with herpes in the U.S. More than 50% of the sexually active people will get an HPV at some point during their lives. 1 in 5 people living with HIV in the U.S. don't know they are positive, and chlamydia is the #1 most reported STD in the U.S. at an estimated 3 million Americans affected each year.
Using contraception while having sex is important to prevent unplanned pregnancies. Unknown to many teens, giving birth to a child is extremely expensive. Had it not been for significant declines in the teen birth rate in recent years, the cost to taxpayers would have been even higher. The teen birth rate in Connecticut declined 43% between 1991 and 2008. The progress Connecticut has made in reducing teen bearing saved taxpayers an estimated $162 million in 2008 alone, over the cost it would have incurred had the rates not fallen.